Good morning. This is Professor Maha Shahin. Today's lecture is about drops and instruments used during ophthalmic examination. First is examination of the eye refraction. On the right is the autorefractometer, simply the autoref. I think most of you has experienced measurement of the eye refraction by the autoref. The patient sits on one side and looks at certain photo in the autoref. The examiners detects the refraction displayed on the screen on the other side. Before the introduction of the autoref, we used the retinoscope on the left side combined with different lenses to measure the eye refraction. On the right is the pinhole occluder. PH means pinhole. The pinhole occluder allows only the central beam of light to pass through the eye. Thus, we can measure the best corrected visual acuity. While prescribing glasses for our patient, we aim to prescribe glasses that allows the patient to get this best corrected visual acuity as detected by the pinhole occluder. In children, the ciliary muscle is very strong. So we aim for cycloplegic refraction, meaning refraction under paralysis of this strong ciliary muscle. So we use this drop seen on the left side to paralyze the ciliary muscle. This slide shows the slit lamp. We use the slit lamp for examination of the eye. Slit lamp is basically a microscope. For examination of the orbit, it's critical to detect proptosis of the eye. Proptosis is protrusion of the eye out of the orbital cavity. We use Hertel exophthalmometer. This is photo shows its usage. We use it to confer the presence or absence of proptosis, to compare between both eyes, and to follow response to treatment in cases of proptosis. On the right are the fluorescein strips and the fluorescein drops. They are used for corneal staining. Corneal staining test is used to detect epithelial defects of the cornea. Fluorescein dye is used together with blue light to detect the epithelial defect. The fluorescein dye has the ability to absorb light in a certain wavelength, which is the blue light in this condition, and reflects this light in another wavelength, which is the green light in this condition. So, areas with positive fluorescein staining will appear green. This area is devoid of corneal epithelium. Another important test in corneal examination is the Schirmer test. Schirmer test is used to detect severe cases of dry eye. As we see, it's graded, folded filter paper which is put in the inferior fornix of the eye. It's left for 5 minutes. And through the scale on this filter paper, we can measure the area wetted by the corneal tears. If it is less than 5, then this patient have a severe dry eye. This is a simple test for dry eye that has been used for over 100 years. How to measure the intraocular pressure? The most accurate method for measurement of the intraocular pressure is the applanation tonometry. On the left is the applanation tonometry. It is applied on the slit lamp as we see on the right side. The cone of the applanation tonometry should touch the cornea. So, the patient's cornea is anesthetized by topical anesthesia, the Binox drops. We use fluorescein dye in addition with the blue light to detect the semicircles we look for measurement of the intraocular pressure. This is the tonopen. The tonopen is a rapid, easy measurement of the intraocular pressure. It is used for screening of cases, but it is less accurate than the applanation tonometer. These are all the methods for measurement of the intraocular pressure. On the right is the Schotz tonometry, which is not accurate, and as we say, it is mentioned to be condemned. It is not used anymore. On the left is the digital measurement. This is the very old historical methods for measuring of the IOP, in which the index fingers is put on the upper part of the globe while the patient is looking downward, and then try to feel the IOP with both the index fingers. Why the patient should look downward? To avoid the hardness of the tarsal plate. This is a very old, rough method for measurement of the IOP. For fundus examination, the pupil should be dilated. We use mydriatic eye drops for dilatation of the pupil. We have three different methods for fundus examination. First is direct ophthalmoscopy using the direct ophthalmoscope. This is the direct ophthalmoscope. To examine the right eye of the patient, hold the direct ophthalmoscope with the right hand and look with the right eye. To examine the left eye of the patient, hold the ophthalmoscope with the left hand and look with the left eye. Direct ophthalmoscope produces large magnification of the fundus, allowing for visualization a small area of the fundus at a time. How to differentiate between retinoscope and ophthalmoscope? The retinoscope is composed of light source and the mirror in one streak. Ophthalmoscope has a viewing window on the patient side. It has an aperture wheel, we can change it. It has a filter selection switch. And this is how the ophthalmoscope looks from the patient side on the left part of the screen. Another method is the indirect ophthalmoscope. Indirect ophthalmoscope is composed of a source of light attached to the examiner's head and a condensing lens. The view shows inverted image of the fundus. The magnification is low, allowing for examination of a great area of the fundus. The patient is preferred to lie down during indirect ophthalmoscope. It is called indirect because we use a condensing lens. The third method is using the slit lamp, the indirect slit lamp biomicroscopy. We use an additional lens, whether contact or non-contact, with the slit lamp to examine the fundus. And this is how the fundus appears using the slit lamp. How to apply the eye drops? This is a very important question. Your friends, your neighbors, your family, even nurses in other departments may ask you what is the best way to apply the eye drops. Let the patient tilt his head backwards. Then pull the lower eyelid, making a pocket. Put 1 or 2 drops from the eye drops in this pocket. The maximum capacity of the conjunctival sac is 1 to 2 drops. Avoid to touch the eyelashes to keep the contents of the eye drop sterile. Close the eye and press against the nose, the bone of the nose, to avoid passage of the eye drops into the throat. And this is of particular importance in the days of Ramadan for fasting Muslims. Drops we use in the ophthalmology clinics are anesthetic, mydritic, cycloplegic, and sometimes myotics. These drops should be available in any ophthalmological clinic. First is the anesthetic drop, the Binox drop. It is used for removal of corneal or conjunctival foreign body and for measurement of the intraocular pressure. This is the mydriatic eye drop. It is used for examination of the fundus. This is the cycloplegic drops, and it is used for measurement of the refraction in the children, in addition for its therapeutic value in different diseases, for example, corneal ulcer or anterior uveitis, and so on. Fluorescein dye has many uses during ophthalmic examination. It is used for measurement of the IOP by the applanation method. It is used for staining of the cornea in cases corneal ulcer is suspected. Again, it is using for measurement of the break-up time in cases suspected to have dry eye. Another use of the fluorescein drop is the Jones test to test the patency of the lacrimal passage. It is not uncommon that dilatation of the pupil leads to precipitation of an attack of angle closure glaucoma. In such case, we aim to constrict the pupil as soon as we can. This is the drop we use for constriction of the pupil. This is the pilocarpine drop. It's a myotic. Thank you for your patience.